Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, Questions 1 to 12. You hear a general practitioner talking to a patient named Mrs. Stevens. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Mrs. Stevens. What brings you in today?
Hi, Doctor. Well, I've been noticing my vision has been getting worse, especially at the edges. I've also had headaches, and my eyes feel sore sometimes. I thought it might be time to get it checked out.
I see. How long have you been experiencing these symptoms?
It's been about 6 months. I first noticed it when I was driving and couldn't see cars on the side unless I turned my head. I used to think it was just me getting older or being tired, but now it's happening more often.
That's concerning, Mrs. Stevens. From what you're describing, it sounds like you may be experiencing early signs of glaucoma. Have you ever heard of it before, or had an eye exam recently?
Yes, my grandmother had glaucoma, but I didn't think it was hereditary. I haven't had an eye exam in over a year.
Glaucoma can indeed run in families, and having a family history puts you at a higher risk. It's a condition that damages the optic nerve, often due to high pressure inside the eye, known as intraocular pressure. The tricky thing with glaucoma is that it often develops without symptoms at first, which is why regular eye exams are so important, especially as we get older.
I didn't know it could be so silent. So, will I go blind from this? It's really worrying me now.
If left untreated, glaucoma can lead to permanent vision loss, and in severe cases, blindness. However, the good news is that with early diagnosis and treatment, we can control the condition and slow the progression. We can't reverse any damage that's already done, but we can certainly prevent further damage. Have you noticed any other changes in your vision, such as seeing halos around lights or experiencing any blurred vision?
Now that you mention it, I've noticed halos around lights, especially at night. It's almost like looking through a fog. I've also had more trouble seeing in dim light or when it's too bright.
Those are classic signs. The halos you're seeing are likely due to the increased pressure in your eye, and the headaches you mentioned could also be related. Glaucoma often causes peripheral vision loss, which is why you're having trouble noticing things on the side, like cars while driving. But in some cases, it can also affect your overall vision, making it harder to see in different lighting conditions.
Wow, I didn't realize how connected everything could be. So, what causes the pressure to build up in my eyes?
The eye produces a fluid called aqueous humor that usually flows out through a drainage system. In glaucoma, that drainage system becomes blocked, causing the fluid to build up and increase pressure in the eye. This pressure damages the optic nerve over time. Unfortunately, the damage can happen so gradually that many people don't realize they have a problem until significant vision loss occurs.
That's really scary. Is there any way to fix it, or at least stop it from getting worse?
While we can't undo the damage that's already been done, we can definitely slow the disease's progression and prevent more damage. The most common treatment is eye drops that help reduce the pressure in your eye. We might also use oral medications or, in some cases, surgery to improve drainage. You'll need to see an ophthalmologist for specialized tests to confirm the diagnosis and determine how advanced your glaucoma is.
I see. And would I have to take these drops forever?
For most people, yes, eye drops are a long-term solution to managing intraocular pressure. You may need to take them for the rest of your life, but your ophthalmologist will help adjust the treatment plan over time, depending on how well you respond. It's very important to use the drops regularly as prescribed, as they're key to preventing further vision loss.
I'll definitely take them if it will help. But do the drops have any side effects?
Some eye drops can cause side effects like redness, stinging, or a slight change in vision. Some people also experience dry eyes. However, there are different types of drops, and your ophthalmologist will work with you to find the one that suits you best with the least amount of side effects. If eye drops aren't enough to control the pressure, other treatments like laser surgery might be recommended.
Laser surgery. That sounds serious. Would that be a last resort?
Laser surgery is a very effective option and is sometimes suggested if medications alone don't control the pressure well enough. The procedure helps fluid drain more effectively from the eye, reducing pressure. There are also minimally invasive glaucoma surgeries (MIGS) that can be done. Your specialist will discuss all the options with you based on your condition. But in most cases, we start with medications and only consider surgery if necessary.
Extract 2. Questions 13 to 24. You hear a specialist talking to a patient called Mr. Glenn. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello. Come in, Mr. Glenn. I've received your file from your GP regarding your ongoing symptoms. I understand you've been experiencing a persistent cough and fatigue for some time now.
Yes, that's right. It's been about 6 weeks. My GP thought it was a chest infection at first, but the antibiotics didn't help. The cough is still there, and now I'm feeling more tired than ever.
I see. Your GP mentioned that you've also experienced some weight loss. Is that correct?
Yes. I've lost about 10 pounds in the last 2 months, but I haven't changed my diet or anything like that.
That's concerning. Weight loss without an obvious cause, combined with a persistent cough and fatigue, suggests we need to explore other possibilities. Have you had any night sweats or fevers recently?
Yes, actually, I've been sweating a lot at night, and sometimes I wake up soaked. I didn't think much of it at first, but it's been happening more often.
That's an important detail. Along with your symptoms of cough, fatigue, and weight loss, night sweats and fever can be signs of a condition like tuberculosis TB.
Tuberculosis? I thought that was something from the past or something people get in other countries.
While TB is less common in places like ours than it used to be, it still occurs, particularly in individuals who may have been exposed to it. It's important to rule it out because TB can sometimes take months to show symptoms, and it requires specific treatment. Have you traveled abroad recently or been in close contact with anyone who has TB?
I haven't traveled, but I work at a community shelter. We've had some people coming in from different parts of the world. I didn't think much of it, but now I wonder.
That could be a potential source of exposure. TB is transmitted through the air when an infected person coughs, sneezes, or even talks. It doesn't mean you'll definitely have it, but we should definitely run some tests to check.
What kind of tests will I need?
The first step is a chest X-ray to see if there are any signs of infection in your lungs. We'll also perform a sputum test, which involves taking a sample of the mucus from your lungs to check for the TB bacteria. Additionally, we may run a tuberculin skin test or a blood test to determine if you've been exposed to the bacteria.
Will the tests show if I have TB right away?
The sputum test will give us the most definitive results, but it can take a few days. The chest X-ray will give us an indication if your lungs are affected. And the skin or blood test can tell us whether you've been exposed to TB bacteria. Based on the results, We'll know what steps to take next.
I've heard TB can be serious. What happens if I do have it?
TB can be serious, but the good news is that it's treatable with a course of antibiotics. The treatment typically lasts about 6 to 9 months, depending on the severity of the infection. It's important to follow the entire treatment plan because TB bacteria can be resistant if the medication is not taken properly.
6 to 9 months seems like a long time. What happens if I don't take the medicine the right way?
That's a great question. If you don't complete the treatment, the TB bacteria may not be completely eliminated, and they can develop resistance to the antibiotics, making it much harder to treat. This is called multi-drug resistant TB, which is much more complicated and requires stronger medications over a longer period.
So it's really important to take the medicine correctly.
Exactly. The treatment involves taking multiple antibiotics, and in some cases people may feel better after a few weeks and think they can stop. But stopping too early can be dangerous. We'll monitor your progress throughout the treatment to make sure everything is going as planned.
What about spreading it to others? Am I contagious now?
TB can be contagious, but typically only if it's in its active form. Based on your symptoms, if you do have TB, there's a possibility it could be active, meaning you could spread it to others. That's why it's important to start treatment as soon as possible. Usually, after a few weeks of taking antibiotics, you would no longer be contagious. But we'll guide you through that process to make sure it's safe for you and others.
That's a bit worrying. Should I avoid work in the meantime?
It's probably best to avoid work, particularly if you're working in close quarters with others. Once we get the test results and confirm whether or not you have TB, we can give you more specific advice on how to protect yourself and others.
What about side effects from the treatment?
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. You hear a respiratory specialist briefing a colleague about the progression of chronic obstructive pulmonary disease or COPD. Read the question.
So, what factors contribute to this worsening?
The main factors include long-term smoking, poor air quality, and repeated respiratory infections. Genetics can also play a role, particularly in those who develop COPD at a younger age. Some patients progress rapidly, while others have a slower decline, which can be influenced by how well their symptoms are managed and how they adhere to treatment.
I see.
The disease tends to advance in stages, but it's not a uniform pattern. Each case is different. We often see exacerbations triggered by infections, which can accelerate the decline.
Okay.
It's essential to monitor patients closely, especially if their exacerbation frequency increases.
Definitely.
You'll need to keep an eye on this patient's recent infection history and check whether any treatment adjustments are necessary based on her progression rate.
Now look at question 26. You hear a medical professional explaining about handling of blood products. Read the question.
Products used in transfusions. First of all, ensure that all blood products are stored at the recommended temperature at all times. Blood should not be left at room temperature for extended periods, and any blood that shows signs of contamination, such as clots or discoloration, must be discarded immediately. Now, when it comes to transfusions, staff must use aseptic techniques when handling blood bags to avoid contamination. Gloves must be worn at all times when preparing and administering blood products, and all equipment must be properly sterilized. This is particularly important as even a slight lapse in protocol can lead to serious infections or complications for patients. Lastly, always verify patient information before administering blood to avoid mismatches.
Now look at question 27. You hear doctor discussing with a neurologist. Now read the question.
Hello, Dr. Patel. I'm calling about a patient I'm referring for a neurological assessment.
Yes, Dr. Edwards. Is this the patient with the severe daytime fatigue and cognitive issues?
Yes, in addition to the fatigue, the patient has also reported having difficulty concentrating and some memory problems. He was diagnosed with sleep apnea earlier this year, but the symptoms persist despite treatment. I'm concerned there could be a neurological cause contributing to his fatigue. I also noticed in his recent appointment that he's been showing signs of mood instability. All the details are in the file, but I wanted to discuss this case because I'm increasingly worried.
Okay. I've reviewed his previous test results. I'll conduct a thorough neurological examination and let you know once I have more information. The patient's appointment is scheduled for next week.
Now look at question 28. You hear an intern talking to a doctor. Now read the question.
Dr. Lewis, I have a question about the postoperative care guidelines you discussed in today's session. Could you clarify something for me if you have a moment?
Of course. Was there anything unclear about the recommendations to reduce the risk of postoperative complications, such as deep vein thrombosis (DVT?
Not the recommendations themselves. I understand that early mobilization is encouraged to lower the risk of DVT, but I'm unclear about the exact mechanism behind why early mobilization helps reduce the risk.
Ah, I see why that might be confusing. Early mobilization encourages blood circulation, particularly in the legs, which helps prevent blood from pooling and clotting. This reduces the risk of DVT formation.
Now look at question 29. You hear a dentist presenting about dental practice. Now read the question.
Well, ever since I was in dental school, I've wanted to open my own clinic. The idea of providing personalized care to my patients, building long-term relationships, and improving their oral health has always been my driving force. But opening a private dental practice has been no easy feat. From setting up the clinic, purchasing equipment, and hiring the right staff, to attracting new patients, it's all been overwhelming at times. Still, the biggest challenge I've encountered is managing the financial side of the practice. I find myself constantly balancing between offering high-quality care that each patient deserves, and seeing enough patients to keep the clinic afloat financially. I'm even considering bringing in another dentist to help share the costs. The financial aspect is something that I've had to focus on a lot more than I initially expected.
Now look at question 30. You hear a trainer conducting a training session. Now read the question.
Poor sleep quality affects an athlete's ability to train, recover from training, perform in competitions, and maintain consistent performance over time. Sleep experts can play a significant role in supporting general practitioners and athletes by conducting a thorough sleep analysis to offer recommendations for improving sleep routines that align with short-term recovery and long-term performance goals. Let's begin by reviewing a case study of an athlete training for a marathon, Maria. Maria had been experiencing inconsistent sleep patterns, and she wanted to assess whether improving her sleep could enhance her performance. We measured her current sleep routine and found that she was averaging around 6 hours of sleep per night, which is below the recommended 7 to 9 hours for athletes. Additionally, her sleep quality was affected by late-night screen time and irregular sleep schedules. We recommended she establish a consistent sleep routine, reduce screen time before bed, and consider mindfulness exercises to improve relaxation before sleep. After a month, her performance and recovery metrics improved significantly.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a Dr. Ava Lewis giving a detailed presentation on the impact of processed foods on our mental health. You now have 90 seconds to read questions.
Good evening, everyone. I'm Dr. Ava Lewis, and tonight I want to discuss a topic that's gaining more attention in health circles, the impact of processed foods on our mental health. We hear a lot about how diet affects our physical health, but what about its effect on the brain? There is mounting evidence showing that what we eat plays a significant role in our mental well-being, and it's something we can no longer ignore. So, let's dive in. What exactly do I mean by processed foods? Well, we're talking about foods that have been altered from their natural state, often for convenience, preservation, or to enhance flavor. This includes things like sugary snacks, fast food, refined grains, and anything packed with artificial ingredients. These foods are typically high in unhealthy fats, salt, and sugars, and low in essential nutrients. Unfortunately, these make up a significant portion of the modern diet. Now, why is this a problem? Because these processed foods are not just damaging to our bodies, they're damaging to our brains as well. Research has increasingly linked high consumption of processed foods to various mental health issues, including depression, anxiety, and cognitive decline. A growing body of evidence suggests that what we eat directly influences our mood, stress levels, and even the risk of developing serious mental health conditions. So, why does food impact mental health so much? One reason is the connection between the gut and the brain, often called the gut-brain axis. This is a two-way communication system, meaning that what happens in our digestive system can affect how we feel emotionally and mentally. For instance, A diet rich in processed foods often leads to inflammation in the body, including in the brain. And chronic inflammation is increasingly recognized as a factor in mental health disorders like depression and anxiety. Furthermore, processed foods lack important nutrients that our brains need to function properly. Omega-3 fatty acids, for example, are crucial for brain health. They help protect brain cells and improve communication between them. These healthy fats are found in foods like fish, flax seeds, and walnuts, none of which are typically found in a diet heavy in processed foods. Similarly, deficiencies in vitamins and minerals such as vitamin D, magnesium, and B vitamins are associated with mood disorders, cognitive dysfunction, and higher stress levels. Now, let's talk about stress. When we're under stress, many of us turn to comfort foods. It's no coincidence that these are usually highly processed foods like sweets, fast food, or snacks high in refined sugars and unhealthy fats. The problem is, while these foods may provide a temporary boost in mood, they actually exacerbate stress in the long run. Processed foods cause spikes and crashes in blood sugar, leading to irritability, fatigue, and mood swings. So while you might feel a brief sense of relief, it doesn't last, and over time, it can make your mental health worse. There's also a link between processed foods and cognitive decline, which is a growing concern, particularly as more people are being diagnosed with dementia and Alzheimer's disease. Studies show that diets high in processed foods, particularly those high in refined carbohydrates and sugars, are associated with an increased risk of cognitive impairment and dementia. On the other hand, diets rich in whole foods, such as fruits, vegetables, nuts, seeds, and fish, are linked to better cognitive function and reduced risk of mental decline. But the good news is that just as poor diet can negatively affect mental health, a healthy, nutrient-dense diet can improve it. We have evidence showing that people who follow diets like the Mediterranean diet, which is rich in whole grains, fresh vegetables, fruits, legumes, and healthy fats, report lower levels of depression and anxiety. They also perform better on cognitive tests and report better overall mood and well-being. In contrast, those who eat a lot of processed foods are more likely to report feelings of sadness, lethargy, and mental fog. So, what can we take from this? It's not just about cutting out processed foods, but replacing them with nutrient-rich whole foods. Focusing on fresh produce, lean proteins, and healthy fats can help protect your mental health and even improve your mood. And it's not about perfection. Making gradual changes and being mindful of what you eat can have a lasting positive impact on both your brain and body. In summary, while processed foods are convenient and often delicious, they come with a heavy price in terms of our mental well-being. The rise in mental health disorders, especially among younger people, is partly linked to our modern diets. By prioritizing whole, nutrient-dense foods, we can not only improve our physical health, but support our mental and emotional health as well.
Extract 2. Questions 37 to 42. You hear a conversation between a journalist and Dr. Thompson discussing adolescent mental health. Now, read the questions. You now have 90 seconds to read questions.
Today we're going to discuss a topic that is integral to adolescent mental health: family dynamics. Family plays a crucial role in shaping a young person's emotional and psychological well-being. To help us explore this, I am joined by Dr. Michael Thompson, an expert in family psychology who has worked extensively with adolescents and their families. Thank you for being here, Dr. Thompson.
Thank you for having me. Family dynamics are often overlooked when addressing adolescent mental health, but they can be one of the most influential factors.
Absolutely. Before we dive into the specifics, could you give us some background on why family dynamics are so important in shaping a teenager's mental health?
Of course. Adolescence is a critical developmental stage where teens are trying to form their identity, but at the same time, they remain deeply connected to their families. Positive family relationships can foster a sense of security and support that helps adolescents navigate the challenges of growing up. On the other hand, negative dynamics, such as excessive parental expectations, ongoing family conflict, or sibling rivalry, can heighten stress and contribute to the development of mental health issues like anxiety, depression, or low self-esteem.
It sounds like there's a lot at play within the family structure. Could you explain how certain dynamics, such as parental expectations, might affect a teen's mental health?
Parental expectations are a big one. Many parents want the best for their children, which is perfectly natural, but sometimes those expectations can become overwhelming. When adolescents feel pressure to meet high academic or social standards, they might develop anxiety or feelings of inadequacy. They may struggle to balance their desire to please their parents with their own personal goals and interests. This internal conflict can become a significant source of mental stress.
That makes a lot of sense. And what about sibling relationships? Can sibling rivalry impact mental health in a similar way?
Definitely. Sibling rivalry, while often considered a normal part of growing up, can escalate into a source of distress, especially if one sibling is consistently favored or more successful than the other. This can lead to feelings of inferiority, jealousy, or even depression in the less favored sibling. It's important for parents to foster healthy relationships among their children and avoid making comparisons, as this can damage a teen's self-esteem and emotional stability.
That's an important point. What about family conflict in general? How does it influence adolescent mental health?
Family conflict, whether it's ongoing arguments between parents or frequent disagreements within the household, can be extremely damaging to an adolescent's mental health. Teens are highly sensitive to the emotional environment at home, and constant tension or unresolved conflicts can lead to feelings of insecurity, anxiety, or even guilt. Adolescents often feel like they need to take sides or resolve the conflict, which places an unnecessary burden on them. Chronic exposure to conflict can make it difficult for them to develop healthy emotional regulation skills.
That must be very difficult for teenagers to cope with. So, how can families better support adolescents to prevent mental health issues from arising?
The key lies in open communication and emotional support. Families that encourage teens to express their thoughts and feelings without fear of judgment create a safe space where adolescents feel understood and valued. Parents should aim to listen more than they speak, helping their children process emotions rather than imposing their own expectations or perspectives. Family routines, such as shared meals or regular family activities, also provide opportunities for bonding and emotional connection, which are essential for mental health.
It sounds like fostering a supportive family environment can really make a difference. Are there other strategies that can help prevent or address mental health challenges in adolescence?
Absolutely. Beyond open communication, families can help by promoting healthy coping strategies, such as problem-solving and emotional management. Adolescents who are taught how to handle stress in a healthy way, by managing their emotions and communicating their needs, are less likely to develop mental health conditions like anxiety or depression. Parents can also set a positive example by managing their own stress constructively and resolving conflicts calmly.
That's a really constructive approach. But what about situations where an adolescent is already struggling with mental health issues? What should families do in those cases?
In those situations, it's crucial that families seek professional help early. Adolescents who are dealing with mental health conditions need both emotional support and access to appropriate treatment, such as therapy. Parents should avoid trying to solve the problem themselves or dismiss the severity of the issue. Instead, they should focus on supporting their teen through the treatment process and continue to provide a stable and caring home environment.
So, early intervention and support are key to helping adolescents manage mental health issues?
Exactly. The earlier a family recognizes and addresses the signs of mental health struggles, the better the outcomes are likely to be. Families can play a huge role in helping their teen recover by being involved in their treatment and providing consistent emotional support. It's important to remember that recovery is a process, and patience is essential.
That's great advice. Thank you so much for your time, Dr. Thompson, and for sharing these valuable insights on how family dynamics impact adolescent mental health.
It was my pleasure. I hope that families will take these points to heart and work to create supportive, understanding environments that promote the mental well-being of their teenagers.
That is the end of Part C. You now have 2 minutes to check your answers.